Question 1. A medical assistant is tasked with performing a blood pressure measurement. Upon applying the cuff, the assistant listens to the sounds using a stethoscope and observes the gauge. The first sound heard is the Korokov sound, which appears when the pressure in the cuff equals the patient's systolic blood pressure. The assistant continues to deflate the cuff and listens for the disappearance of these sounds, which indicates the patient's diastolic blood pressure. Following is the correct procedure for determining blood pressure using the auscultatory method. A. The assistant should inflate the cuff 101 G above the estimated systolic blood pressure to avoid missing the systolic reading. B. The assistant should keep the cuff inflated for a prolonged period to ensure a more accurate diastolic reading. C. The assistant should inflate the cuff above the expected systolic pressure, deflate the cuff rapidly, and record the pressure at the point where the first Korokov sound is heard. D. The assistant inflate the cuff to 200 mHg and release the air slowly, recording both the systolic and diastolic pressures when they are both audible. Answer. C. The assistant should inflate the cuff above the expected systolic pressure, deflate the cuff slowly, and record the pressure at the point where the first Korokov sound is heard, systolic pressure, and the point where these sounds disappear, diastolic pressure. This technique ensures an accurate assessment of blood pressure. Explanation. The auscultatory method involves inflating the cuff to a point above the expected systolic pressure to occlude the artery. As the deflated slowly, the blood flow resumes, and the assistant listens for Korokov sounds. The first sound marks the systolic pressure, and the disappearance of the sound marks the diastolic pressure. The other answers are incorrect because they either do not align with the standard procedure or suggest incorrect techniques for blood pressure measurement. Question 2. Scenario question. Dr. Morgan is working in a busy clinic and has been asked to assist in a minor surgical procedure. The patient, Mrs. Green, is scheduled for the removal of a benign mole. The procedure will require the application of a local anesthetic, a sterile field, and the use of surgical instruments. Dr. Morgan has explained the procedure to Mrs. Green, but the patient is still unsure about some aspects of the surgery. Anesthesia. What should Dr. Morgan do to ensure that Mrs. Green has the right to make an informed decision? A. Dr. Morgan should have a colleague provide the patient with a brief overview of the procedure, as the colleague can answer any further questions Mrs. Green may have. B. Dr. Morgan should ensure that Mrs. Green receives detailed information about the risks, benefits, and alternatives of the procedure and anesthesia and obtains written consent from her before proceeding. C. Dr. Morgan should perform the procedure without further discussion if the patient agreed to the procedure previously and is only asking clarifying questions. D. Dr. Morgan should ask Mrs. Green to sign a generic consent form that was prepared by the office manager without additional explanations to save time. Answer. B. Dr. Morgan should ensure that Mrs. Green receives detailed information about the risks, benefits, and alternatives of the procedure and anesthesia and obtains written consent from her before proceeding. Explanation. Informed consent is a fundamental ethical and legal requirement in medical practice. It involves providing the patient with all the necessary information, including the risks, benefits, and alternatives of the procedure to allow the patient to make an informed decision. A signed consent form alone does not suffice if the patient has not been properly informed. Option is incorrect because the colleague cannot replace the physician in providing crucial information regarding the procedure. Option C is incorrect because the patient's questions must be addressed to ensure understanding. Option D is also wrong as generic consent forms are inadequate for ensuring the patient understands the procedure. Question 3. Which of the following best describes the role of personal protective equipment (PPE) in a healthcare setting, and how should a medical assistant use PPE to maintain infection control protocols? A PPE should be worn in all situations, regardless of the patient's condition, as it is always required for safety. PPE is mandatory only during high-risk procedures like surgeries and must be discarded immediately after use, with no cleaning or reusing allowed. C. PPE should be worn when exposure to bodily fluids or contaminated surfaces is likely, and the equipment must be selected based on the type of exposure risk. E. PPE is primarily for the protection of healthcare workers and does not need to be used unless the patient is known to have an infectious disease. Answer. E. PPE should be worn when exposure to bodily fluids or contaminated surfaces is likely, and the equipment must be selected based on the type of exposure risk. Explanation. Personal protective equipment (PPE) is a critical part of infection control protocols, especially in environments where there is a risk of exposure to bodily fluids, contaminants, or pathogens. The appropriate selection of PPE, such as gloves, masks, and face shields, depends on the nature of the exposure risk. It is not required in all situations. Option A, and should only be used when necessary. Option B is too restrictive, as PPE may be reused in some cases following specific protocols, depending on the type of equipment. Option D is incorrect because even in the absence of visible symptoms, healthcare workers must follow EPE protocols to protect themselves from potential exposure to pathogens. Question 4. A medical assistant is preparing to perform a venipuncture on a patient for a routine blood test. The patient has expressed anxiety about the procedure and seems particularly apprehensive about the needle. The medical assistant must ensure the patient's comfort while following proper protocol. What steps should the medical assistant take to address the patient's anxiety and ensure a successful and safe blood draw? A. The medical assistant should inform the patient about every step of the procedure and take extra time to explain how the needle will feel during the process. B. The medical assistant should reassure the patient briefly but proceed with the venipuncture immediately to avoid further anxiety from unnecessary conversation. C. The medical assistant should attempt to distract the patient by engaging in unrelated small talk, avoiding further discussion about the procedure. D. The medical assistant should assess the patient's anxiety, provide a calm and clear explanation of the procedure, and use a calming technique to ensure comfort while maintaining a professional and efficient approach. Answer D. The medical assistant should assess the patient's anxiety, provide a calm and clear explanation of the procedure, and use a calming technique to ensure comfort while maintaining a professional and efficient approach. Explanation. It's important to address patient anxiety as it can affect the success of medical procedures. The medical assistant should explain the procedure in simple terms and inform the patient of what to expect. Taking the time to explain procedure. Answer 8 helps, but excessive detail might increase the patient's anxiety. Option B skips the necessary communication and can worsen patient anxiety. Option C distracts the patient from important procedural details and might not alleviate concerns about the needle. Therefore, maintaining a calm, informative, and reassuring approach while performing the task efficiently is essential. Question 5. A medical assistant is scheduling a patient's next appointment for a routine physical exam. The patient's medical history includes diagnosis of hypertension. The patient also reports difficulty managing stress, which seems to have contributed to their elevated blood pressure levels. When scheduling this appointment, what additional considerations should the medical assistant take into account to support both the patient's well-being and the ability to provide the best care? A. The medical assistant should schedule the patient for the next available slot, ensuring the physician has adequate time to address the patient's concerns without considering any special requirements for the patient's condition. B. The medical assistant should schedule a longer appointment and ensure the physician is informed about the patient's hypertension and stress levels to allow for more in-depth discussion. C. The medical assistant should delay the appointment and ask to follow up with stress management program before scheduling. D. The medical assistant should ask the patient to contact the office if any urgent issues arise and schedule regular appointment without any special considerations. Answer. B. The medical assistant should schedule a longer appointment and ensure the physician is informed about the patient's hypertension and stress levels to allow for more in-depth discussion, explanation. When dealing with chronic conditions such as hypertension, especially when the patient's stress levels are contributing to the condition, scheduling longer appointment times ensures that the physician can thoroughly assess and address the patient's physical and psychological health. Option doesn't account for the need for adequate time or special attention. Option C is unnecessary, as the patient should not be delayed for follow-up without addressing the immediate healthcare needs. Option D minimizes the importance of the patient's condition and disregards necessary communication between the medical assistant and physician. Question 6. Scenario question. Mr. Harris is scheduled for a routine urinalysis as part of a physical examination. Upon collection of the sample, the medical assistant notices that the specimen has been contaminated with toilet paper. The sample is no longer suitable for testing, but the patient has already left the clinic. The medical assistant must inform the patient and ensure that the necessary steps are taken for a proper specimen collection. The appropriate course of action the medical assistant should take in this situation. A. The medical assistant should notify the patient as soon as possible. Request a new specimen and provide instructions for proper collection in a timely manner to prevent delays in the diagnostic process. B. The medical assistant should attempt to use the contaminated sample for testing and report any inconsistencies, as the patient may be unavailable for resubmission. C. The medical assistant should send the contaminated sample to the laboratory, testing and note the contamination in the report, leaving it to the lab to make any determinations. D. The medical assistant should discard the contaminated specimen without contacting the patient, assuming the test is not critical and can be done at the next visit. Answer A. The medical assistant should notify the patient as soon as possible, request a new specimen, and provide instructions for proper collection in a timely manner to prevent delays in the diagnostic process. Explanation: a contaminated specimen compromises the accuracy of test results. The medical assistant must inform the patient promptly and provide guidance on proper collection techniques to avoid contamination, such as ensuring the use of a clean container and instructing the patient on a midstream collection. Option B disregards the integrity of the test, while option C leaves responsibility for a contamination issue to the laboratory, which is not appropriate. Option D fails to engage the patient in resolving the issue and misses the opportunity to correct the sample collection procedure. Question 7. A patient is prescribed a new medication and the medical assistant is responsible for educating the patient on how to take the drug properly. The assistant notices that the patient is unsure about the medication's purpose and how it fits into their overall treatment plan. Which of the following should the medical assistant do to ensure that the patient is adequately educated about the new medication and understands the instructions? A. The medical assistant should provide the patient with printed brochure about the medication and ask them to read it at home. B. The medical assistant should review the medication's purpose, dosage, and potential side effects and offer written instructions to ensure the patient fully understands the regimen. C. The medical assistant should refer the patient back to the prescribing physician to answer any medication-related questions and avoid providing any advice. D. The medical assistant should give the patient a list of all medications they are taking, instructing them to follow the instructions on the labels without further explanation. Answer: B. The medical assistant should review the medication's purpose, dosage, and potential side effects and offer written instructions to ensure the patient fully understands the regimen. Explanation: medication education is a key part of patient care. The medical assistant should explain the purpose, correct dosage, potential side effects, and any instructions related to the medication, ensuring the patient is fully informed and comfortable with their treatment. Instructions, option B, serve as helpful reminder. Option may not provide enough clarification, and option C does not adequately address the patient's needs. Option D does not involve proper discussion of the medication or its specific instructions, leaving the patient unprepared for proper use. Question 8. Which of the following is the most accurate explanation for the process of HIPAA compliance in a medical setting, particularly regarding the sharing of patient information within the healthcare team? A. HIPAA allows for unrestricted sharing of patient information between healthcare providers as long as the patient has signed a consent form. B. HIPAA requires healthcare providers to share patient information freely within the healthcare team as long as the team members are working on the patient's case. C. HIPAA ensures that patient information is only shared with the patient's explicit consent or under certain legal circumstances, limiting access to necessary personnel. D. HIPAA allows for the sharing of patient information with anyone in the healthcare organization as long as the information is related to treatment. Answer: C. HIPAA ensures that patient information is only shared with the patient's explicit consent or under certain legal circumstances, limiting access to only necessary personnel. Explanation: the Health Insurance Portability and Accountability Act, HIPAA, mandates strict controls on the sharing of patient information. While healthcare providers within the same team can share information necessary for the patient's care, all disclosures must be limited to the minimum necessary information and authorized by the patient or required by law. Option is incorrect because HIPAA does not allow unrestricted sharing. Option B is not correct because sharing should be limited to only necessary personnel. Option D oversimplifies the process and disregards patient consent and confidentiality laws. Question 9. A medical assistant is preparing a patient for an electrocardiogram. The patient has questions about the procedure and is concerned about the discomfort from the electrodes. The medical assistant must explain the procedure while ensuring the patient's comfort. Which of the following explanations should the medical assistant give to the patient regarding the procedure? A. The procedure will take just a few minutes and the electrodes will feel like mild pinch or brief sensation of heat. B. The electrodes will cause some discomfort, but the procedure is quick and the results will be available soon. C. The electrodes are applied to your skin and you may feel slight pressure, but they do not cause pain, and the procedure will help us monitor your heart activity. D. The electrodes will be placed on your chest, and which may cause discomfort, but the test is necessary for diagnosing heart problems. Answer: C. The electrodes are applied to your skin and you may feel slight pressure, but they do not cause pain, and the procedure will help us monitor your heart activity. Explanation: the medical assistant should provide a clear and calm explanation to alleviate patient anxiety about the procedure. The electrodes are applied to the skin with minimal pressure and there should be no pain involved. This reassurance helps the patient feel more comfortable, informed. Option is not ideal as it introduces unnecessary discomfort, pinch and heat. Option B is inaccurate because the patient should not expect discomfort during the procedure. Option D introduces the concept of discomfort unnecessarily and may increase the patient's anxiety. Question 10. A patient comes into the office for a routine physical examination. During the assessment, the medical assistant observes that the patient appears fatigued and has slight swelling in their legs. Upon asking about their symptoms, the patient mentions they have been feeling unusually tired and have noticed a decrease in appetite for the past few weeks. What is the best course of action for the medical assistant to take in this situation? A. The medical assistant should reassure the patient that fatigue and swelling are common in many individuals and suggest they rest more frequently. B. The medical assistant should document the symptoms but proceed with the physical exam without further investigation into the patient's concerns. C. The medical assistant should immediately inform the physician of the patient's symptoms to ensure proper follow-up and diagnostic testing. D. The medical assistant suggests that the patient change their diet to increase energy levels and schedule follow-up visit in few months. Answer: C. The medical assistant should immediately inform the physician of the patient's symptoms to ensure proper follow-up and diagnostic testing. Explanation: fatigue, swelling, and decrease in appetite could indicate an underlying health issue that requires further investigation. The medical assistant should not dismiss these symptoms but should inform the physician to ensure the appropriate next steps are taken, including any necessary tests. Option could overlook the possibility of more serious condition, while option B does not properly address the patient's concerns. Option D also does not address the need for medical evaluation. Question 11. A medical assistant is working in a busy clinic and is responsible for scheduling appointments. One day, a patient calls to cancel an upcoming appointment. However, the patient also expresses concerns about their recent weight gain and asks for advice on how to address it. The medical assistant knows that the patient has a history of diabetes. How should the medical assistant handle this situation? A. The medical assistant should reassure the patient that their weight gain is likely unrelated to their diabetes and suggest they reschedule their appointment without further discussion. B. The medical assistant should immediately advise the patient to change their diet and increase their physical activity to manage weight gain without consulting the physician. C. The medical assistant should acknowledge the patient's concerns and encourage them to reschedule the appointment and inform the physician so that proper assessment can be made. D. The medical assistant should suggest that the patient take weight loss supplement to address the weight gain and remind them to make their next appointment. Answer: C. The medical assistant should acknowledge the patient's concerns, encourage them to reschedule the appointment, and inform the physician so that proper assessment can be made. Explanation: while the medical assistant cannot offer medical advice or make diagnoses, they should acknowledge the patient's concerns and encourage the patient to reschedule the appointment. Informing the physician ensures that the weight gain, especially with history of diabetes, is addressed. Thorough assessment. Option dismisses the patient's concerns, while option B goes beyond the assistant's scope of practice. Option D suggests an unproven solution and may not be in the best interest of the patient. Question 12. A patient is preparing for a colonoscopy and needs to follow specific instructions for bowel preparation. The medical assistant provides the patient with a list of required preparations, including fasting and taking a prescribed medication to clear the bowels. The patient is confused about the timing of the medication and asks for clarification. What should the medical assistant do in response? A. The medical assistant should reassure the patient that it's okay to take the medication whenever they feel like it, as long as they fast. B. The medical assistant should reiterate the importance of following the specific instructions exactly as given, including the timing of the medication, and provide clear, step-by-step explanation of the process. C. The medical assistant should tell the patient to call back if they have any further questions but not provided details. D. The medical assistant should suggest an alternative preparation method if the patient seems unsure about the instructions. Answer. B. The medical assistant should reiterate the importance of following the specific instructions exactly as given, including the timing of the medication, and provide a clear, step-by-step explanation of the process. Explanation. 4. A colonoscopy bowel preparation is critical for the procedure's success. The medical assistant should provide clear instructions and reinforce the importance of following the timing of the medication exactly as prescribed to it. The best results option is incorrect because it fails to emphasize the importance of following the specific instructions. Option C leaves the patient without the needed information, and option D suggests deviating from the recommended preparation process. Question 13. A patient comes into the clinic complaining of chest pain. The medical assistant notes the patient's elevated blood pressure and reports that the patient's medical history includes hypertension and hyperlipidemia. What should the medical assistant do first in response to this patient's symptoms? A. The medical assistant should immediately check the patient's blood glucose levels and schedule them for follow-up visit in few weeks. B. The medical assistant should inform the physician immediately and ensure that the patient is promptly assessed to rule out heart attack or other cardiovascular issues. C. The medical assistant should suggest the patient relax and rest in the waiting room to reduce stress levels, assuming that chest pain is likely stress-induced. The medical assistant should refer the patient to cardiologist for immediate testing without consulting the physician. Answer. B. The medical assistant should inform the physician immediately and ensure that the patient is promptly assessed to rule out a heart attack or other cardiovascular issues. Explanation. Chest pain in a patient with hypertension and hyperlipidemia is a potentially serious symptom that may indicate a cardiovascular issue such as a heart attack. The medical assistant must inform the physician immediately so that the patient can receive a thorough evaluation. Option A does not address the urgency of the situation, and option C downplays the seriousness of chest pain. Option D bypasses the physician and is not within the medical assistant's scope. Question 14. A medical assistant is working in an office that provides pediatric care. A parent calls with concerns about their child's fever, which has lasted for 2 days. The child is also experiencing mild cough and fatigue. The parent is wondering if they should bring the child in for an appointment. What should the medical assistant advise the parent to do? A. The medical assistant should advise the parent to monitor the child's temperature and bring them to the office if the fever persists for more than 3 days. B. The medical assistant should suggest the parent treat the fever at home with over-the-counter medications and avoid scheduling an appointment unless the child's condition worsens. C. The medical assistant should reassure the parent that the symptoms are likely due to common cold and advise them to wait seeking medical care. D. The medical assistant should suggest the parent bring the child in for an appointment immediately to rule out any serious conditions, regardless of the current symptoms. Answer A. The medical assistant should advise the parent to monitor the child's temperature and bring them to the office if the fever persists for more than 3 days. Explanation. In cases of fever and mild symptoms, a medical assistant should suggest the parent monitor the child's condition and seek further medical attention if the symptoms persist. This avoids unnecessary visits but ensures the child will be evaluated if necessary. Option B dismisses the possibility of an underlying condition. Option C also minimizes the situation and might delay appropriate care. Option D might not be necessary if the child's symptoms are mild and improving. Question 15. A patient reports that they are having difficulty remembering to take their prescribed medication and is asking for advice on how to improve their adherence to the treatment regimen. What is the best response from the medical assistant? A. The medical assistant should suggest the patient set an alarm or reminder on their phone to help them remember to take their medication at the correct times. B. The medical assistant should tell the patient to stop taking the medication until they are able to establish a routine that works better for them. C. The medical assistant should advise the patient to reduce the dosage of the medication if they find it difficult to adhere to the prescribed schedule. The medical assistant should encourage the patient to take the medication only when they feel it is necessary, rather than following the prescribed schedule. Answer A. The medical assistant should suggest the patient set an alarm or reminder on their phone to help them remember to take their medication at the correct times. Explanation. Helping the patient with strategies to improve adherence is important. Setting a reminder or alarm is a practical solution that can assist the patient in following the prescribed medication schedule. Option B is incorrect because stopping the medication without the physician's approval could harm the patient's health. Options C and D provide incorrect advice and could compromise the patient's treatment. Question 16. A medical assistant is tasked with assisting a physician in performing a minor surgical procedure. The patient has a history of allergies, and the medical assistant is reviewing the patient's medical chart to ensure the necessary precautions are taken. What action should the medical assistant take prior to the procedure? A. The medical assistant should immediately notify the physician if there are any discrepancies in the patient's medical history or allergies and ensure the correct surgical instruments are available. B. The medical assistant should confirm the patient's allergies with them once more before starting the procedure and proceed without further delays. C. The medical assistant should focus on setting up the procedure room and defer any concerns about allergies to the physician. The procedure has begun. D. The medical assistant should contact the patient's pharmacy to check for any medications that may interfere with the procedure. Answer A. The medical assistant should immediately notify the physician if there are any discrepancies in the patient's medical history or allergies and ensure the correct surgical instruments are available. Explanation. Ensuring patient safety is paramount in any procedure. The medical assistant should verify the patient's allergies and alert the physician of any concerns before proceeding with the surgery. Option B does not prioritize communication with the physician and might lead to delays. Option C fails to address the critical need for reviewing patient allergies before starting the procedure. Option D involves unnecessary steps when the medical assistant should focus on the patient's immediate medical chart and history. Question 17. A medical assistant is processing a patient's medical records in the office. During the process, the assistant notices that the patient's insurance information has expired and the patient has not updated their insurance details in over 6 months. What is the most appropriate action for the medical assistant to take? A. The medical assistant should immediately inform the patient of the expired insurance information and request updated details before proceeding with any further care. B. The medical assistant should proceed with scheduling the patient's appointment without addressing the insurance issue, as it can be dealt with later. C. The medical assistant should update the patient's information without informing them about the expiration to avoid causing embarrassment. D. The assistant should schedule the patient's next appointment and wait for the patient to mention the insurance issue during the visit. Answer A. The medical assistant should immediately inform the patient of the expired insurance information and request updated details before proceeding with any further care. Explanation. It's important to address insurance issues promptly to avoid delays in care or payment issues. The medical assistant should notify the patient about the expired insurance and request updated information. Option B risks delaying important billing issues, while Option C bypasses the patient's need to know. Option D delays necessary action and could cause issues during the next appointment. Question 18. A patient arrives at the clinic with complaints of severe headaches that have been occurring for the past 2 weeks. The medical assistant notices that the patient appears uncomfortable and is rubbing their eyes frequently. The patient also reports feeling nauseous and lightheaded. What should the medical assistant do first in this scenario? A. The medical assistant should document the patient's symptoms and suggest they take over-the-counter pain medication to relieve the headache. B. The medical assistant should refer the patient to an optometrist for an eye exam to rule out vision-related issues. C. The medical assistant should inform the physician immediately so that further evaluation can be conducted to rule out any underlying conditions. D. The medical assistant should advise the patient to and monitor the symptoms, scheduling a follow-up appointment if the headaches persist for more than a week. Answer. C. The medical assistant should inform the physician immediately so that further evaluation can be conducted to rule out any underlying conditions. Explanation. Severe, persistent headaches accompanied by nausea and lightheadedness could be indicative of a serious underlying condition such as a neurological issue. It is critical that the medical assistant informs the physician right away so the appropriate tests and evaluations can be done. Option that overlooks the potential severity of the symptoms, while option B is too narrow given the symptoms. Option D delays necessary medical intervention. Question 19. A new patient arrives at the clinic with A history of asthma and seasonal allergies. During the intake process, the patient reports using an inhaler daily and taking over-the-counter antihistamines. The medical assistant notices that the patient appears slightly short of breath and is wheezing lightly. What is the best course of action for the medical assistant? A. The medical assistant should assure the patient that their symptoms are normal and suggest they continue their current treatment regimen. B. The medical assistant should immediately inform the physician about the patient's shortness of breath and wheezing to determine if further treatment is needed. C. The medical assistant should recommend an over-the-counter decongestant and advise the patient to monitor their symptoms at home. D. The medical assistant should schedule the patient for follow-up appointment in few weeks and suggest they avoid environmental allergens. Answer. B. The medical assistant should immediately inform the physician about the patient's shortness of breath and wheezing to determine if further treatment is needed. Explanation. Shortness of breath and wheezing in patient with history of asthma could indicate an asthma exacerbation or another serious issue. It is important to immediately inform the physician so that the patient can be properly assessed and treated. Option ignores the possible seriousness of the symptoms, while option C provides incomplete advice. Option D does not address the immediate concern of shortness of breath. Question 20. A patient in the office is diagnosed with hypertension and prescribed a blood pressure lowering medication. The patient mentions that they have difficulty remembering to take their medication regularly. The medical assistant is tasked with helping the patient develop a strategy to improve adherence to the prescribed regimen. What should the medical assistant recommend? A. The medical assistant should suggest the patient take the medication only when they feel their blood pressure is high. B. The medical assistant should advise the patient to set a daily reminder on their phone or use a pill organizer to help track their medication schedule. C. The medical assistant should recommend the patient ask a family member to remind them to take the medication each day. D. The medical assistant should suggest that the patient alternate medication schedule to make it more manageable. Answer. B. The medical assistant should advise the patient to set a daily reminder on their phone or use a pill organizer to help track their medication schedule. Explanation. Medication adherence is crucial, especially for conditions like hypertension. Setting reminders or using a pill organizer can help the patient stay on track with their medication regimen. Option is unsafe because it encourages the patient to skip doses. Option C may help, but it is not a long-term solution. Option D could alter the effectiveness of the medication. Question 21. A medical assistant is tasked with preparing a patient for a routine physical examination. During the intake process, the medical assistant notices that the patient is visibly anxious and is pacing in the waiting room. The patient mentions they are afraid of the results of the examination and have been feeling overwhelmed recently. What is the best approach for the medical assistant to take in this situation? A. The medical assistant should dismiss the patient's anxiety and focus on the medical tasks at hand, as the examination will not take long. B. The medical assistant should acknowledge the patient's anxiety, provide reassurance, and offer to answer any questions the patient may have before the examination. C. The medical assistant should suggest the patient take a sedative to calm their nerves before proceeding with the examination. D. The medical assistant immediately inform the physician about the patient's anxiety and leave the room to allow the patient some space. Answer. B. The medical assistant should acknowledge the patient's anxiety, provide reassurance, and offer to answer any questions the patient may have before the examination. Explanation. Acknowledging the patient's emotional state and providing reassurance can help ease anxiety before a medical exam. Offering to answer questions shows empathy and helps the patient feel more in control of the situation. Option. It disregards the patient's feelings, while option C is inappropriate, as the medical assistant cannot prescribe medication. Option D may be helpful in some situations, but may not address the patient's emotional needs effectively. Question 22. A medical assistant is preparing a patient for a blood draw. The patient expresses fear of needles and mentions they have fainted during past blood draws. The medical assistant is aware that the patient has a history of fainting during medical procedures. What should the medical assistant do to best assist the patient? A. The medical assistant should reassure the patient that this time will be different and proceed with the blood draw without addressing the patient's concerns. B. The medical assistant should suggest the patient lie down during the blood draw to minimize the risk of fainting and ensure their comfort. C. The medical assistant should immediately call for a physician to perform the blood draw, as it may require special care. D. The medical assistant should tell the patient that fainting is common and that they should just try to relax. Answer. B. The medical assistant should suggest the patient lie down during the blood draw to minimize the risk of fainting and ensure their comfort. Explanation: to help prevent fainting, it is best for the patient to lie down during a blood draw, especially if they have a history of fainting. This position helps reduce the likelihood of a fainting episode. Option A dismisses the patient's concerns, and option C is unnecessary for a routine blood draw. Option D may be reassuring but does not address the patient's fear or physical needs appropriately. Question 23. A medical assistant is assisting with a patient who is being treated for a chronic condition. The patient has been prescribed multiple medications and has expressed difficulty managing their medication regimen due to the number of pills and timing. What is the best strategy for the medical assistant to suggest to the patient? A. The medical assistant should suggest the patient cut down on the number of medications by stopping some on their own. B. The medical assistant should recommend the patient set up a medication calendar or use a medication management app to organize their medications. C. The medical assistant should tell the patient to take all their medications at once to simplify the process. D. The medical assistant should suggest the patient ask their family members to manage the medications for them. Answer: B. The medical assistant should recommend the patient set up a medication calendar or use a medication management app to organize their medications. Explanation: organizing medications through a calendar or an app can help the patient remember their regimen and manage multiple prescriptions effectively. Option is unsafe as it may lead to medication mismanagement. Option C could result in the patient missing doses or taking medications incorrectly. Option D may help in some cases, but is not the most empowering or long-term solution for the patient. Question 24. A patient comes into the clinic for a routine visit and is noticeably upset. They mention that they have been feeling stressed at work and at home, which has been affecting their sleep and overall well-being. The patient asks the medical assistant for advice on how to manage their stress. What should the medical assistant do? A. The medical assistant should advise the patient to take a break from work and rest, as stress is common and should not be a concern. B. The medical assistant should suggest that the patient practice relaxation techniques, such as deep breathing or meditation, to manage their stress. C. The medical assistant should recommend that the patient consult with a mental health professional for counseling and therapy. D. The medical assistant should provide a list of medications to help with stress and anxiety. Answer: B. The medical assistant should suggest that the patient practice relaxation techniques, such as deep breathing or meditation, to manage their stress. Explanation: stress management strategies such as relaxation techniques can help the patient address their symptoms in a non-invasive way. Option A minimizes the importance of stress management. Option C may be appropriate but requires a physician's referral. Option D would be inappropriate as it is outside the medical assistant's scope of practice to suggest medications for stress. Question 25. A medical assistant is assisting a patient who is scheduled for a minor surgical procedure. The patient is nervous about the procedure and asks the medical assistant for more information about the recovery process. What is the most appropriate response from the medical assistant? A. The medical assistant should tell the patient that recovery will be quick and easy without discussing any potential complications. B. The medical assistant should explain the general recovery process, including potential pain, downtime, and any restrictions the patient should follow post-procedure. C. The medical assistant should refer the patient to the surgeon for detailed information about the recovery process. D. The medical assistant should assure the patient they will be fully healed in a few days and will be able to resume normal activities right away. Answer: B. The medical assistant should explain the general recovery process, including potential pain, downtime, and any restrictions the patient should follow post-procedure. Explanation: the medical assistant should provide clear and realistic information about the recovery process to help manage the patient's expectations. This includes potential pain, downtime, and necessary restrictions. Option and Option D provide overly optimistic views that may not reflect the reality of recovery. Option C is a valid option if the patient requires more detailed information from the surgeon. Question 26. A patient calls to inquire about the results of their recent lab tests. The medical assistant has access to the results but is unsure whether they are final or pending. The patient is anxious and insists on knowing the results immediately. What is the most appropriate action for the medical assistant to take? A. The medical assistant should provide the results to the patient even if they are not finalized, to avoid causing further anxiety. B. The medical assistant should check with the physician to confirm whether the results are final and explain the situation to the patient. C. The medical assistant should tell the patient that the results are not available and encourage them to call back in a few days. D. The medical assistant should assure the patient that the results fine and schedule a follow-up appointment even if they do not have access to the final report. Answer: B. The medical assistant should check with the physician to confirm whether the results are final and explain the situation to the patient. Explanation: the medical assistant should verify the status of the test results with the physician before sharing them with the patient to ensure accurate information is provided. This approach prioritizes patient safety and clear communication. Option A could lead to the release of inaccurate information, while option C is dismissive. Option D is not appropriate as it involves making assumptions about the results without proper knowledge. Question 27. A patient arrives at the clinic for a follow-up appointment after being diagnosed with type 2 diabetes. The medical assistant notices that the patient seems confused and hesitant to provide information about their blood sugar levels, even though the doctor has asked for the patient to keep track of them. What is the best course of action for the medical assistant to take? A. The medical assistant should advise the patient that it is not essential to monitor their blood sugar levels, as their condition is manageable with medication alone. B. The medical assistant should explain the importance of monitoring blood sugar levels and encourage the patient to keep a daily log, offering assistance if needed. C. The medical assistant should inform the physician that the patient is non-compliant with their treatment plan and let the physician handle the situation. D. The medical assistant should tell the patient that the physician will not be able to help them if they are unwilling to monitor their blood sugar levels. Answer: B. The medical assistant should explain the importance of monitoring blood sugar levels and encourage the patient to keep a daily log, offering assistance if needed. Explanation: it is essential for patients with type 2 diabetes to monitor their blood sugar levels regularly. The medical assistant should explain the importance of this and offer guidance to help the patient maintain compliance with their treatment plan. Option A undermines the patient's health needs, while option C avoids direct interaction with the patient. Option D could alienate the patient and hinder communication. Question 28. A patient with a history of heart disease presents with complaints of chest pain and shortness of breath. The medical assistant notices the patient appears anxious and is clutching their chest. What is the most appropriate action for the medical assistant to take in this situation? A. The medical assistant should immediately attempt to reassure the patient that it is just stress and suggest they take deep breaths to calm down. B. The medical assistant should take the patient's vital signs, inform the physician, and prepare the necessary equipment for an emergency assessment. C. The medical assistant should call for cardiologist to assess the patient immediately. D. The medical assistant should inform the physician that the patient is simply anxious, likely experiencing panic attack. Answer: B. The medical assistant should take the patient's vital signs, inform the physician, and prepare the necessary equipment for an emergency assessment. Explanation: chest pain and shortness of breath could be signs of serious heart issue, such as heart attack, and immediate action is required. The medical assistant should assess the patient's vital signs and inform the physician promptly. Option downplays the seriousness of the symptoms, while option C may be excessive, and option D incorrectly dismisses the potential severity of the condition. Question 29. A patient who has been prescribed an antibiotic for a bacterial infection calls the clinic and reports a rash, fever, and swelling of the lips after taking the medication. The patient is concerned that they may be having an allergic reaction. What is the best response from the medical assistant? A. The medical assistant should reassure the patient that this is a common side effect of antibiotics and advise them to continue taking the medication. B. The medical assistant should suggest the patient stop taking the antibiotic and call back in a few days if the symptoms persist. C. The medical assistant should advise the patient to stop taking the antibiotic immediately and inform the physician about the potential allergic reaction. D. The assistant should recommend the patient take an antihistamine to relieve the symptoms and continue with the medication. Answer: C. The medical assistant should advise the patient to stop taking the antibiotic immediately and inform the physician about the potential allergic reaction. Explanation: a rash, fever, and swelling could indicate a serious allergic reaction such as anaphylaxis. The medical assistant should advise the patient to stop taking the antibiotic and notify the physician immediately. Option A is dangerous as it downplays the seriousness of an allergic reaction. Option B delays necessary intervention, and option D could worsen the reaction. Question 30. A medical assistant is conducting an intake assessment for A patient who has a history of hypertension. The patient mentions that they have been feeling dizzy and lightheaded recently, especially when standing up quickly. What is the best course of action for the medical assistant? A. The medical assistant should document the symptoms and inform the physician, as dizziness may be a side effect of hypertension medication. B. The medical assistant should reassure the patient that dizziness is normal with high blood pressure and suggest they drink more fluids. C. The medical assistant should suggest that the patient take their blood pressure more frequently and make adjustments to their medication regimen. D. The medical assistant should tell the patient to avoid standing up too quickly and not worry about the symptoms unless they become more severe. Answer A. The medical assistant should document the symptoms and inform the physician, as dizziness may be a side effect of hypertension medication. Explanation: dizziness, especially upon standing, could indicate orthostatic hypotension, a potential side effect of hypertension medications. The medical assistant should document the symptoms and inform the physician for further evaluation. Option B downplays the importance of addressing the symptoms, while option C is outside the medical assistant's scope of practice. Option D fails to adequately address the potential severity of the situation.